She is trained as a physical therapist she trained at Columbia University and later earned a doctorate in physical therapy. She continued with her self-education with complementary medicine approaches, including Tai Chi, martial arts, yoga, dance, and meditation. She's a certified trainer in the Feldenkrais method and teaches internationally, training new practitioners. Last year, she was a keynote speaker at the International Congress of Physiotherapists in Bogota, Colombia, presenting on the topic of Feldenkrais and chronic pain. She works at Stanford in the Coordinated Care Clinic, and since 1988 has maintained a private practice at the Feldenkrais Center for Movement and Awareness in San Francisco. Please join me in giving a warm welcome to Dr. Bose.
Okay, so I'm super happy to be here and to have this opportunity to talk with you and share an approach for improving function and reducing pain called the Feldenkrais method. So as Dr. Darnell said, for 30 years I've been studying alternative and complementary medicine. And that includes all kinds of mind-body approaches that use awareness or mindfulness in a way of thinking about and working with the whole person. So it's very exciting to be included in a program like this. When I first started, I was more relegated to the quack category. So it's nice to see that the world of medicine has come along. So I'm going to talk about Feldenkrais method and how it helps with back pain. So first I'll describe the method because probably many of you have no idea what this word is or what it's about. I'll go over some principles and ways that you can apply them in your life. And then we'll have some time for an experiential exercise too. So the Feldenkrais method is a learning model. It kind of fits in what everyone's been saying this morning. And it's a biopsychosocial model of working with yourself. So biopsychosocial models of medicine means that there are multiple and complex factors that interact and affect your health. So that also means that there's multiple ways of changing and influencing how you can improve. So you can't really think of just one cause and one solution. And that works really well if you have a broken bone. You know the bone has to heal. But in chronic pain or back pain, we know that there's a lot of elements that contribute to either making you feel better or making you feel worse. So how you think, how you move, how you sense yourself, how you feel, your habits, your attitudes, all of these things are part of the pain pattern, and they're going to affect your experience with pain or any health condition that you have. So Feldenkrais method could be described really as learning for health. In the Feldenkrais method, you explore your movement options or possibilities. You want to develop greater awareness about your habits of movement and posture, breathing, and even how the attitudes that you have towards your body affect the pain and affect the total experience of yourself. Oops. So this quote is from Moshe Feldenkrais. Movement is life. Life is a process. Improve the quality of the process, and you improve the quality of life itself. So Feldenkrais is not a rote training. No one's going to tell you, oh, this is how you sit. This is how you arrange everything. And people aren't going to say, you must do these exercises. It's more, as Dr. Cooley was talking about, finding what works for you. Feldenkrais is a training so that you can improve the way that you sense and feel yourself. And then, according to that feeling and that sensation, you can adjust what you do based on that, the quality of that experience. So there are principles of good movement, and I'd like to talk to you a little bit about that. So with back pain, your movement is altered, right? You move differently once you have back pain. And the way that you move then is part of the problem. So these altered movement patterns, or that you've adjusted how you do something, it's a normal response to having pain or an injury. And in the ideal situation, it would just be a temporary adjustment. But what happens, the way the brain works, that temporary change then becomes a permanent habit. And they start to cause other problems. So some of the things that you might do is maybe you use too much effort. Maybe your breathing is restricted. Or you don't feel how the skeleton supports you. You overuse some parts of the spine and don't use others. So, for example, I would say just about everybody I work with low back pain has very little movement in the thoracic spine and the rib cage. So to explain that, if you think of your lumbar spine, the lumbar vertebra, it's 5 vertebrae, and it takes up about this much space of your spine, right? So it's at the lower part of the spine, that much space. On top of that is the thoracic vertebra. There's 12 of them, and they all have ribs attached to them, and they take up this much space. So if you can learn to sense this much of your spine, the thoracic spine, you can reduce the strain on the lumbar spine. Each part of the spine is designed to do a different kind of movement. So the lumbar spine, the way the facet joints, the way it's made, is made to do flexion and extension. So that's like, you can't see me because I'm behind the podium, but it means you kind of stick your butt out and tuck your butt, right? So you're rocking. I'm going to step to the side. So flexion and extension, right? Babies do it. It's one of the first movements we do. Thoracic movement. The thoracic spine is built to do so many other kinds of movements, twisting, side bending, a little bit of arching, a little bit of flexing. If you're not using the thoracic spine movement, then all of that kind of movement is going to the lumbar spine. It's why people who have back pain are often told, don't twist. But it really should be, no, twist with the rest of your spine that's made for twisting. So that's the kind of thing that I teach people that are based on these principles of good movement. So I have written down here the sense of lengthening of the spine. So what does that mean? So the sense of lengthening of the spine, meaning that your spine is long, that you're not compressing it. So you can compress your spine many ways. But one way people often do it is they compress their spine by kind of flexing and shortening. And the length we're talking about is from the back of the head to the back of your sacrum. So you want that line long so that there's space between the discs, that there's space in the facet joints. So by learning these principles of good movement through exploration and practice, it's not just thinking about them, it's called embodied learning, and then you can use that in your everyday life. So Moshe Feldenkrais is the man who put this method together, and he was an Israeli scientist who combined various of his knowledge and skills and studies from the sciences of physics, engineering, psychology, with judo and child development, and he put together this method, or a process that uses learning, a particular kind of learning with directed attention and movement patterns to improve function. So the method has 2 modalities. So one is called awareness through movement. And awareness through movement lessons are led and guided by a teacher. There's no demonstration. So the teacher, she'll give verbal directions and suggestions that have a particular sequence. It's a structured sequence to explore some function like bending or breathing or reaching. And so in this photo, these students are on the floor, and the teacher, who's me in my younger days, is guiding the students to explore the relationship between breathing and the pelvic floor. And that's one of the areas that gets affected also with back pain. So here, the woman on the left, is learning how to roll with the whole body, exploring how to turn the spine, how to turn the ribs, how to sense herself as she's doing that. And the group on the right is sitting and exploring how to find an easier and more comfortable way to sit. So each person is asked to move according to their own ability, and there's no ideal posture. There's these principles of good movement to follow. Not that you want to match someone else's movement, but to find your own way through it. And you're looking for a way that's easy and doesn't increase pain or reduces the unpleasantness of the movement. There's also what we call functional integration, which is the hands-on work. We use the same principles, and the main difference is that the practitioner is touching you very sensitively. It's the kind of touch you would use if you were guiding a small child through a dance, right? You're going to be very lightly touching them and guiding them, not grabbing them or forcing them to do anything. So this kind of touch stimulates the brain's natural ability to notice differences, make distinctions, and then change. And this functional integration, treatment, the person can feel where they're holding tension, where they're afraid to move, and then they can learn how to change this pattern. So curiosity is a basic function of the brain and nervous system. Curiosity motivates us to find solutions, answers to questions. If you strengthen your curiosity, you can discover many ways to move better. And curiosity is one of our fundamental tools in Feldenkrais. So this, what's up on the slide, a simple model of what the nervous system does. So Moshe Feldenkrais was fond of saying that the nervous system has three important functions. One, it gives us information about our body. Two, it gives us information about the environment. And three, it provides the curiosity to do the first two. In my work with people with all kinds of pain and back pain, I found that there's definite problems in these functions. So number one, the information about the body may be limited. The person may be only sensing, does it hurt or not hurt? That the ability to sense some of the other human sensations that we have, like ease and comfort and pleasure, or the sense of length or the sense of getting wider, those sensations are put down, and the more unpleasant sensations speak louder. In relationship to the environment, people with pain have told me when the pain is very strong, it's very hard to sense where they are in space. People have trouble crossing the street, trying to judge how fast the cars are coming. They may bump into things and often feel vulnerable out in public or in crowds. And curiosity, for me, curiosity is the big one. Curiosity is often diminished. And this could be because the person hasn't had any success yet in finding what they need to learn how to improve their function. And hopelessness might set in. So the kind of exploration process we use in Feldenkrais helps to really use your curiosity. And we ask questions. And we ask questions to get your attention. So some of the questions might be, how are you doing a movement? Where do you put your attention? How could you make it easier? How could you do less? So this is the process. And you can learn, once you have that kind of process, you can apply it in many, many parts of your life. Another quote from Moshe Feldenkrais is that we do not achieve by repetition, muscle exercising, by increasing speed and force, but by widening and refining the cerebral control of the muscle range. So in plain speak, right, that means in order to improve movement, you have to use the coordinating role of the brain. And learning to move with less pain is a skillful activity. You learn to inhibit the strain that you're putting into the system. So you can use the brain's ability at any age. It will change no matter where you are in the spectrum. That's what learning is. And this capacity for learning and the capacity for the brain to change is called neuroplasticity. And I'm sure you've read a lot about that. It's all in the news now. So now we can do a little bit of experiential to try to make concrete what I'm talking about, right? Words are just words, but it's the experience that's really important. So we're going to do something in sitting first. So if you have stuff on your lap, maybe you could just put it to the side or put it on the floor and just allow yourself to sit comfortably in the chair and what you think is comfortable. And now bring your attention to the quality of your sitting. And if you had to sit like this for a long time, are there any places that you would feel uncomfortable? Right? Where does that strain come for you? Where do you feel the support for your body? What parts of you are touching the chair? Do you have any sense of the skeleton, the bones inside you supporting you? What's happening with your breathing? Do you feel any movement of your body with your breath? How are your legs arranged? Are the legs together? Are they apart? Where are the feet touching the floor? Now slowly, if it's comfortable for you, without causing any pain to yourself, slowly come to standing. So how did you do that? Did you use your arms on the chair? Did you feel your feet push the floor? The big one, did you hold your breath? And if you didn't hold your breath, when you came up to standing, did you do it on an inhale or an exhale? What were you thinking? So you might think, yeah, finally I get to get up a little bit. Or you're thinking like, oh no, right? All of these elements affect the quality of your movement. So now you know the chair is still behind you, so slowly return to sitting. How did you do that? Did you use your arms? When you went down to sit, did your feet stay on the floor or did the toes come up? Did you inhale as you sat? Exhale? Hold your breath? And if you held your breath, did you hold it after you inhaled or after you exhaled? There's so many details that we can pay attention to in our movement that we're completely unaware of. But when someone asks you the question, your curiosity, right, is stimulated. And then you start to seek, well, how did I do that? And have I made the choices in my movement that actually are helpful? So now in the chair, sit and arrange yourself as if you were going to stand. So knowing that you're going to stand, how do you arrange yourself? Right, so some people scoot a little bit, some people put their arms on the chair. Do you have your feet in a place where you don't have to move them in order to stand up? So generally it would be useful if you were a little bit more to the front of the chair, right? So that you don't have to kind of haul your heaviest part of the body from the back of the chair. Now start to sway your body. So start to just kind of sway a little bit forward, a little bit backward. It's so fun to do this teaching and see everybody start moving, right? So you're just swaying a little bit forward and back. Now, you're swaying on the hip joints. So to be able to feel that, place your hands on the hip joints. So your hip joints, they're not like on the side. It's where you bend, so somewhere in here. And now start to sway and feel how your hands get kind of squeezed in there, right? That you're bending at the hip joint. So this is where the movement first takes place to come to stand. Why? So the spine can stay long. So now sense the length of your spine from the back of your head to the sacrum. And notice if you change that line as you just sway forward. Okay, good. Now take both hands and just feel the back of your neck. And now sway forward and back and see, so you're actually on the muscles of your neck, right? You are using your hands as listeners, as feelers. So as you sway forward and back, sense and feel, are you contracting your neck? Can your neck stay very relaxed? So you come forward and back, because you don't need to use your neck muscles to stand up. It happens in the legs, in the hips. Okay? Now take one hand and put it on your chest, on your breastbone, And then the other hand can either go on your belly below your belly button or behind your back on your sacrum. So you put the back of your hand on the sacrum. And now again, sway a little bit forward and back. And can the hands stay at the same distance apart? So you're not flexing or extending as you move. The hands you can feel like, uh-oh, I'm really flexing as I come forward, or I'm extending. Right? How can you just feel for yourself? And are you breathing? So now, as you go forward and back, when do you breathe out? And when do you breathe in? There's many ways, but could you now match your breathing to your movement, that when you come forward, you exhale, and when you go back, you inhale. So you're kind of breathing with the whole body, breathing as you out as you go forward and in as you come back. Okay, great. Take your hands off, pause a moment. So now place your hands on the chair as if they were going to help you. You may not need to use your hands to come up, but just we have a big room and want to make sure everyone is comfortable. And have your pelvis, we talk a lot about the pelvis in Feldenkrais because the pelvis is really the power seat that initiates movement. So bring your pelvis now to the edge of your chair. So you're really at the forward edge of the chair, your hands are gently touching the chair. And start to sway forward using everything we know, keeping the spine long. When do the feet get heavier? When does the weight go more onto the feet? Because that's what you've got to do in order to stand up. Can you feel that? Can you sense that? Everyone's at a different place for sensing. For some, this might be something you need to practice later. Okay. Now, when you feel the weight come onto the feet, start to stand by pushing into the feet to come up. So feel the weight on the feet, push, use your hands as you need to, and then come up. Did you hold your breath? You can ask yourself that almost any time of day. Whenever you think something's hard or effortful, you hold your breath. And then that makes it hard and effortful. All right? So now, sensing the weight on your feet, notice your toes. Right? And as you go to sit, keep the weight on the whole foot so your legs lower you and you're not using your back. So slowly lower yourself, bending the hips, the knees, keep the weight in the feet, and slowly sit. Very nice. And now just sense the way you feel in sitting. Do you have any more idea of the support that you have from the chair or the internal support that you have from your skeleton? We can all regain these sensations are there, and they're there in a snap if you direct your attention in a particular way to your movement. So it takes more than alignment or flexibility. So some people think back pain solution, it's all about alignment. It's all about posture. Others say, no, it's all about flexibility. And other people say, no, it's strength. You have to do strength. Especially in America, the paradigm is whatever you got wrong with you, you got to get stronger. That's not it. It's how you use yourself. So if we look here at the Eiffel Tower and the Wicker Man, what's the difference? Right? The Eiffel Tower, perfect alignment, recognized around the world, but it is not going anywhere. Right? Now, if you look at the Wicker Man, there's a potential for so much movement there. But the Wicker Man can't do anything unless there's a system to coordinate all that movement. So from research, we know that more of the brain is devoted to movement than any other aspect. We have a big problem dealing with gravity. You fall down, you had an unsuccessful encounter with gravity, right? And each moment, the brain and the nervous system is receiving all of this complex sensory information from your touch, from sight, from hearing. And in movement, the most important system is the kinesthetic system. So the kinesthetic system is the sensation of movement. It tells you, like right now, your kinesthetic system tells you where your joints are in space. You know where your arms are, right? You don't have to look for them. The kinesthetic system gives you information about how much effort you're using in your joints. And when you have back pain, the kinesthetic system is severely affected. So a lot of training, in Feldenkrais is to train the kinesthetic system, to learn how to notice yourself. So we always start each class lying on the back and doing a body scan. 1 minute? Seriously? Okay, I'm going to speed up. So you have to learn how to sense yourself by sensing and feeling where you are. And we begin with scanning different parts of the body and breathing so that you have a comparator later on. We use small movements to activate the spinal stabilization system and avoid setting off pain. You can find out how you move the easiest and gain control so you can do bigger things. You want to reduce the effort in movement so you can feel more of what you're doing, have less compression in your joints and greater sensitivity. And you want to do whole body movements because the solution for your pain is not necessarily where you feel the pain. If you involve other parts in the movement, you can take the strain off the injured or painful part. As Corinne said, muscles do not work alone. They work in synergistic patterns. And then you want to attend to the qualities of movement and breathing like ease or comfort or smoothness. This organizes and creates new and pleasurable patterns of movement. Movement can be pleasurable. Even with pain, you try to have the least amount of pain. And the results are that you overcome the fear of moving. You can experience yourself as I can rather than I can't. You can trust your body again. And you solve movement problems that help you solve other kinds of problems. You develop a sense of agency and you rediscover pleasure in movement. So to end, I would like to leave you with one last small short experience in sitting. There are some parts of the brain that are more important to relax or become aware of because more of the innervation or more of the real estate of that body part in the brain it's bigger. So like your hands, your feet, your eyes, breathing, and balance. If you can pay attention to those 5 parts, I call it the 5 questions, you can really have a big effect on relaxing the whole body. So right now, pay attention to your hands. Place your hands on your lap, whatever is comfortable, touching each other or not, and just now soften your hands. So make your hands very relaxed, softened, easier to move, not clenching. Think of the spaces between your fingers. And now bring your attention to your feet. And even though you have shoes on, think of the feet and the softness in your toes. Are you clenching the toes? The softness in the arches. Maybe you move the feet a little bit within your shoes. And now your eyes. The eyes are little brain buds. With your eyes, just gently shift where you're looking. When you have pain, the eyes become fixed. You can tell people are hurting. You say, wow, I see it in your eyes. So just by shifting your eyes and looking left and right or looking far into the distance and then close can change and interrupt the pattern that's including the eyes. And now sense your support. How are you supported? Right in the chair and your pelvis, the support of your feet and legs. And what's going on with your breathing? So for one breath cycle, pay attention to breathing in and breathing out. So these 5 questions can be used to practice. And the way I use them is I encourage my patients as I just say, what am I doing with my eyes, my hands, my feet, breathing, and where is my support? So I'll end by saying there's a lot of Feldenkrais research, both qualitative and quantitative. There's more that needs to be done. But it's a very good showing that if this is an option and appeals to the way that you would like to work with yourself, Feldenkrais method is a very good option for helping you learn how to have less pain and more function. And I'd like to thank my colleague and collaborator, Cliff Smythe, who's also my husband. And I work at Coordinated Care, and the people that I work with there every day teach me more and more how to help people with back pain. So thank you very much.